It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. OCD, in dogs, osteochondritis dissecans. No, OCD is not a condition that forces your dog to constantly check his buried bones or constantly lick his paws. In this case, OCD means osteochondritis dissecans, a painful joint disease that affects the shoulders, elbows, and knees. OCD mainly affects large breed dogs. It is quite common in Golden Retrievers, German Shepherds, Rottweilers, Great Danes, Mountain Dogs, and St. Bernards. Not all large breeds are vulnerable. OCD is less likely to affect Doberman Pinschers, Collies, and Siberian Huskies. The most common cause is rapid bone development, so OCD usually occurs in puppies between 4 and 8 months of age. However, it can occasionally be found in older dogs as well as smaller breeds. It affects male dogs about 5 times more often than female dogs. The pain is caused by inflammation and injury to the smooth cartilage in your dog's joints, right where the bones meet. Small pieces of cartilage break off and float freely in the joint. Those pieces of cartilage don't die, they continue to grow. Once they float freely, fluid builds up and calcification occurs. The joint becomes inflamed and swollen, the nerves become irritated, and the puppy feels pain. 1. Causes of osteochondritis dissecans in dogs. No one is quite sure what causes OCD. Obviously, heredity is part of the problem, and if you can, you should ask if your dog's mother or father had the condition. Too much stress on a young dog's bones, restricted blood flow to the cartilage, diet and nutrition, and weight problems may also be factors, but it is not known exactly to what extent the condition can be prevented. 2. When it's time to see a vet. It's pretty easy to tell if your dog has OCD. First, consider whether your dog is one of the large breeds prone to this condition. If so, pay attention to any of these signs. Limp. Favors one paw or leg when walking or even lying down. Swelling in the shoulder or, more rarely, in the elbows and knees. Pain when trying to extend a swollen joint. A veterinarian can make a solid diagnosis with an exam and some x-rays. 3. Treatments. There are 2 types of treatment for osteochondritis dissecans in dogs, conservative and surgical. Conservative treatment is used in mild cases and in younger dogs. It's basically 4 to 10 weeks of very restrictive bed rest, where walking is limited to going to the bathroom. That means no running or frolicking. As difficult as it may be to enforce this, the cartilage will heal on its own in about 60% of cases, and the dog will be able to play again. Surgery is used in more severe cases or when the conservative approach has not worked. In surgery, the veterinarian will remove the joints and repair the injuries. After surgery and a couple of weeks of rest, almost all dogs make a full recovery and are back to 100% function. It is very rare for the condition to recur. Prevention. Prevention is a dubious proposition. Some people believe that a growing, overweight dog will be more likely to develop osteochondritis dissecans, but there isn't much evidence yet. Still, it makes common sense to protect a puppy's limbs from unnecessary physical impacts, such as repeated jumping off a deck or from a car. And diet certainly plays a role. There are a number of puppy foods that promote healthy bone growth and can reduce your dog's chances of contracting osteochondritis dissecans. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.